From the Detroit Free Press, it's Friday, August 14th. Here are today's top stories. Presented by Bush's Fresh Food Market. Calling all foodies, Bush's is hiring. Are you passionate about food, looking for growth, development, and excellent wages? Come grow with Bush's and apply online at bushes.com/join our team. That's Bush's, BUSCHS.com/join our team.
For the Detroit Free Press, I'm Kerry Jr. II. Michigan's health department reported 16 deaths Thursday. 9 of them were uncovered in a review of death certificates. There are 1,121 new cases of the coronavirus reported, and in total there are over 90,000 cases and nearly 6,300 deaths statewide. The Federal Drug Administration denied Henry Ford Health researchers' request for emergency use of the drug hydroxychloroquine on COVID-19 patients. The FDA already ruled against the use of the drug in June, but Henry Ford says its research suggests it needs a second look at it. Free Press reporter Kristen Jordan-Shamus has the full story. What's the story behind the FDA, Detroit's Henry Ford Health System, and the drug hydroxychloroquine?
Sure. Early in the pandemic, some research in France suggested that hydroxychloroquine might reduce the coronavirus load in a small group of patients. So researchers around the world started to launch studies and clinical trials to see if they could also replicate that research and prove that hydroxychloroquine could help people with the virus. And because it looked so promising, back in March, the FDA granted emergency use authorization, which means that hospitals like Henry Ford could start using it in COVID-19 patients. But it got a little bit tricky because the more experts started doing this research, the more conflicting evidence came to the surface. And they started to report dangerous side effects like heart problems that were tied to hydroxychloroquine. So at first, the FDA issued a warning. And then in June, it completely revoked authorization and said that doctors could no longer use hydroxychloroquine to treat COVID-19 outside of a clinical trial. So if you had existing research going on, you could still use it. But outside of research, there was no use for hydroxychloroquine.
What were the results of Henry Ford's research study?
On July 2nd, its study suggested that hydroxychloroquine does work and that it cut the death rate of COVID-19 in half. But that became very, very controversial research, and a lot of people were calling that study flawed. In addition, they also said that the hydroxychloroquine study at Henry Ford was used in combination with a steroid, and that steroid has been known to improve outcomes for people with COVID-19. So the idea was that it wasn't really a clean study that definitively answered anything. And so right after Henry Ford published that study, a couple days later, it sent a letter to the FDA saying, we want authorization to use hydroxychloroquine again. And this week, the FDA responded and said no. It denied their request.
What was Henry Ford's motive behind requesting to use it after the FDA already said that it couldn't be used?
They stand by the outcome of their study that, showed that hydroxychloroquine helped and didn't hurt. And their leaders, the health system's leaders, have all said that they think more research has to be done to really prove whether hydroxychloroquine is helpful or not when it comes to the treatment of COVID-19.
And will additional research be done on hydroxychloroquine?
Well, there is research that's still underway, and Henry Ford is actually part of that research, but it's a little bit different. It's not necessarily in the treatment of COVID-19, but for the prevention of COVID-19. So back in April, Henry Ford announced in conjunction with Detroit Mayor Mike Duggan that it would conduct what's called the WHIP COVID-19 study. And it's the first large-scale study to investigate whether hydroxychloroquine can prevent coronavirus in healthcare workers and first responders. And that study is still underway, and results haven't been published yet.
Free Press reporter Kristen Jordan-Shamus, thanks so much.
Thank you for having me.
That's the latest.
This is Jeff Seidel from the Detroit Free Press. The Tigers are in the thick of a playoff race. Is it real? We don't know yet, but I do know the Tigers would have a better shot if they put their best players on the field. That means it's time to bring up Casey Mize. At this point, there's only one argument to wait to bring him up. so that he can preserve one more year before arbitration. But there's a flip side to that argument. By not bringing him up, you run the risk of slowing his development. Mize, the Tigers' top pitching prospect, is 23 years old, which is already older than many pitchers when they made their debut. Jack Morris was 22, Justin Verlander 22, Clayton Kershaw 20, Steven Strasburg 21, and Garrett Cole 22. This team is 9-7 and in a great position. Why not go for it? Why not put your best team on the field? But I wouldn't just bring up Mize. I'd bring up Matt Manning, at the very least, to work out of the bullpen. And I'd bring up Tarek Skubal. I know Skubal was sick with COVID, but as soon as he can pitch a couple of innings, bring him up. Instead, they are all in Toledo. It feels like Christmas morning has been put on hold and a bunch of presents are stuck in Toledo, which totally stinks. Let's get these young kids experience and let them feel a push for the playoffs. Let's kickstart this rebuild instead of wasting another year. This is Jeff Seidel from the Free Press. Go to freep.com.
For more stories from the Detroit Free Press, be sure to check out freep.com. That's FREEP.com. If you're a fan and want to support our quality local journalism, subscribe. Go to freep.com/special offer.